Hi, everyone. This is Sean with the MassSupport Network here with the Massachusetts Public Health Report for Friday, November 6th, 2020. So there was a couple of changes with Massachusetts reporting this week. We'll go through them. One thing to note, though, is that the regular public health report was incomplete as of its usual release last night. So there are a couple of things we normally do that aren't going to be in this presentation. But we'll go through and show some of the new features we've got as well. To start with, the state is now releasing the estimate of active cases in the state. This is published in the regular dashboard, and so we can kind of get an idea of how many circulating infections there are, not just knowing how many people are in quarantine or isolation. So that's a very interesting number to have, and going forward, we'll start to compare that week over week. Also on the right side of the screen there, we have the breakdown of cases by age group. This is also very interesting because it shows us, sort of where the virus is spreading. And it's interesting to note right now that the largest group is actually people less than 20. Okay, this can be a little confusing there though, because 19 to 0 is an age group that has a lot of different populations in it. And if it's not broken out a little more than that, obviously even the 18 and 19 group shows some very different things than the 17 to 0 group, as that would include college students, and knowing if this is spread coming from K through 12 schools or through institutions of higher education would be an interesting thing to know. However, we still have a lot of in the kind of middle years, the 20s and 30s, but a lot fewer cases now during the elder years there, which is interesting to note because with this other chart we have now, we can see how the different age demographics have been the drivers of the virus over time. So this chart goes from children at the bottom up to seniors at the top in bands of 20 years. And at the beginning there, we have the start of the pandemic. And then in April, we have that spike in the 80+ year demographic as we saw the virus get into a lot of nursing homes and do a lot of great damage there. Then over time, we've now got to the present day where there is some pretty even distribution between age demographics, with the elder ones actually tapering off as there's been more protections around care facilities, for example, and I think a lot of senior citizens are also taking extra care of their own health as well. But you can see the largest rising has been the youngest demographics there, especially the youngest one there, which has gone from almost nothing to increasing steadily. Now, part of this may be due to where we're doing testing, because if you recall at the beginning of the pandemic, there was a lot of confusion as to whether children could be infected at all. And so we were testing children a lot less then. But now also, of course, we have reopened schools to some extent, so there's probably a bit more spread there, but testing may confound that as well, because we've been able to have the testing infrastructure necessary to test people who are not symptomatic or at high risk. We're catching a lot more cases than we were before. Speaking of testing, the state is now also releasing its average turnaround time for test results. This is about 1.8 days. That's pretty good right there. Less than 48 hours between getting your tests taken and getting the report to the Department of Public Health. Now there may be a little bit of lag there for the contact tracing team to reach out to people after that, but the actual time frame that it takes to process the test is staying pretty tight there, which is good. We'll also look at this week over week to see if we're getting backlogged as the winter months go on and spread maybe possibly even increases. So you look at where things are right now. This is where we stood last week with cases under quarantine. These are, of course, not confirmed cases. These are the people who are waiting for that period until they've got their test results, or maybe they've been exposed and are going through the full quarantine process to make sure that they don't develop symptoms. As you remember, you can't test out of quarantine. If you've had exposure, you could be in a situation like how, for example, the White House press secretary who tested negative 4 days in a row and then on the 5th day was positive. But this is where things stood last week, and here's where we are now with about 500 additional people additional people in quarantine with suspected cases or exposure. Looking on to confirmed cases, this is where things stood last week at 13,700 people in isolation. And now we have just over 17,000 cases currently in isolation. So you may recall when we looked at the active cases list number earlier, that thought that there was about 18,279 cases in the state. So that's about 800 and change cases that are out there that are not in isolation. Some of those might be caught in quarantine, but there may be some others out there that we just haven't found yet. So looking at how the hospitals are doing, actually the hospitalizations are down this week by a significant number. Seems a lot of people were discharged recently. However, ICUs and intubations have both gone up, and I'm not quite sure if the way they show this data is including those figures in there, in which case a change in hospitalizations might just be because people are moving into ICU. But generally speaking, their hospitalizations are down. We should probably expect these to spike back up again, though, as case counts continue to rise. Looking at the demographics, have not really changed in the last 2 weeks. Who's getting infected? As we saw earlier, the average age of new cases is 38. The average age of deaths is 80. And that is down 1 year from the week before. The other two numbers have not changed. So looking at how our contact tracers are doing with the new cases coming out at such a high speed, it seems like we are struggling a little bit here to catch up. So the overall percentages for case outreach completed and contact outreach completed are down 0.4% and 0.2%. Now these include the cases from the entire pandemic, so sometimes they can be a little non-representative. So if we look down here at last week and this week, you can see that we've got last week in the middle here and this week at the bottom, and you can see that the percentages of people we've reached have dropped significantly. It's probably the biggest drop we've seen. However, given that the numbers, the raw numbers are increasing, they're probably actually reaching more people, just there's just so many more people to reach. You can also see that the percentage of people who are reached within a single day has dropped dramatically there. And that's just going to be the backlog of people here through. So one of the things that contact tracing works very well when we can stay on top of cases. But as we saw out in the Dakotas, they had to basically abandon contact tracing because it just wasn't worth it. They were not getting people in time to make a difference. By the time they were able to reach the cases, it didn't help. So something to be aware of here, and hopefully we can keep things below that level. Looking at where spread is, now this is one graphic that they were not able to put out with the public health report. They're expecting it later today. So this is where things stood last week with case spread in terms of cases per 100,000 people per day over a week. So I don't have a new version of this. I made a simple mock-up by county here, showing how much spread there is in any given county. So the numbers there are the number of new cases per day per 100,000 people over the last 2 weeks. So where our biggest spread is going to be in Suffolk County, Bristol, Essex, and Hampton. We still are seeing lighter spread in places like Barnstable, Franklin, and Berkshire counties, but it's still significantly up. And you may have noted on the last slide, last week, the state daily rate was 11.8 new cases. Now it's 15.3. That's a big jump there, almost 4 new cases per day per 100,000 people. Things are very much trending up, as we can also see when we look at percent positivity. So this is where things stood last week, the percentage of tests that were coming back positive. And here is where things stand right now. So you can see any given towns that might have jumped on that weren't there before. Of course, this can be a little bit non-representative in smaller areas where, for example, there may only be 10 tests that need running, And if 2 of those come back positive, well, that's a huge number there. But you can see a lot of places are getting that darker and darker blue. In the northeast, the southeast, there's a part here in north around Springfield as well. There's sort of an interesting little corridor here that the positivity is low, and that may just be because that is a place that has a lot of testing, or maybe they're just preventing spread very well there. That is some areas outside Boston, so those may also be suburbs that get less spread into them if people are able to work from home. But one other way that so to conclude, percent positivity has gone up 0.3% in the last week, which is another big jump there. However, it's important to note that this can be also non-representative because so many of the tests we are running are for colleges and universities. So in higher education, we're doing a lot of screening testing, which means testing people that we would not necessarily guess were infected and probably aren't. Whereas a lot of other testing is done to people who have had exposure. And so what this means, if you look on the right side of the screen here, you can see they've actually broken the percent positivity into what just the higher education is coming back with, and the rest of the state if you take the higher education tests out of there. And so that shows we actually have a much higher percent positivity than we would otherwise. Now, that itself might be slightly higher because there are some people in the college settings we would be testing anyway, but it just shows that this positivity that's still turning below 2% may not be indicative where things really stand on a population level if you account for the way that we're kind of diluting the test pool. Because if you look at the number of tests we are running for higher education versus the rest of the state, the light blue is what we're running for our colleges and universities, and the dark blue is the rest of the state. So it's close to half the tests are going to higher education. And again, since these are more screening tests, then that will drive the positivity lower overall. Now, to be fair, we are also doing a lot of screening tests in the rest of the state, particularly in places like long-term care facilities that are testing their staff, every week or two. So that will still catch a lot of things there. But also, in terms of the way these tests are coming back, most of the tests that are positive are going to be far and away from the state as a whole, rather than this thin layer of positive tests from higher education. Now, that said, positive tests in colleges and universities have almost doubled in the last week. There was 175 new cases last week and the week before, and then this past week we've seen 362. And that is with even a slight reduction in testing. There are 2,000 fewer tests conducted, so that's definitely not catching additional cases we wouldn't have otherwise with increased testing. That is just an increase there, almost doubling. So we'll see how that goes as the weeks progress. If their programs are able to aggressively isolate people who are testing positive, maybe they can cut this off, but oftentimes we may see this just start to increase exponentially. Also, with any of these collegiate numbers, just take these with a grain of salt, because we don't know. This is gathering all colleges together, so there may be many colleges which are doing great work and keeping the cases down, and there may be just a couple ones that are having uncontrolled outbreaks. So different universities' policies will wildly affect the numbers, and when they're taken all together, it's off. So when we look at where things are going with the state right now, this is the last 2 months of 7-day averages of cases. And as you can see, we have gone pretty steadily up. We did have one little blip there last week. I don't know if we had a testing snag or something there, but we have risen and continue to rise. We're almost 3 times the cases per day that we were at the beginning of the month. And I should expect this number to rise because this is a 7-day average. So the last couple of days have been especially high. And as we move forward in the week, the average should jump quite a lot there. Now, looking at this county by county, here are the counties that are having low transmission numbers. Now, these, of course, are raw numbers. So a smaller county will account for a larger percent of the population, but these are the ones with the lowest spread right now. It's really kind of a tale of two Massachusettses right now, because all of these counties, Barnstable, Berkshire, Dukes, Franklin, Hampshire, and Nantucket, are getting generally low overall spread, though especially with places like Nantucket and Dukes, we should be aware those are actually having an incidence rate of around the state average of 15.4 new cases per 100,000 people, but the actual numbers are very small because they are tiny islands. But so we can see things have trended up in lower cases, but not a huge amount. Some that were less than 2 cases per day are now getting maybe between 4 and 6. And then Barnstable and Hampshire counties, which are the most populous of these ones here, have steadily gone up from around 5 cases per day to around 12 or 14 cases per day. So that's a big increase there for them. However, when we look at the bigger counties, we see quite a lot here, and there's a big jump. Which is that the previous ones were all, ending the period. This is the last 3 weeks with fewer than 20 new cases per day. Here, we're all looking at around 75 new cases per day or more as the bare minimum there. So a lot of spread. Now, some places, though, there's always a trend upwards here. Some ways it's not quite as much. For example, I'm going to pick out, I think Norfolk there has been just kind of slightly going up. Plymouth has likewise stayed more or less even on this scale, but we've seen a lot of things shoot up, especially Bristol, Worcester, Hampden counties were all, in the 50s, 60s at the start of the month, and are now some of them over 100 cases per day. And then, of course, Eastern Mass, our big counties, have just steadily gone up the whole time. Citrus of Suffolk has dropped down, so it's not the highest anymore. But Middlesex and Essex, in terms of raw cases, are far and away where most of the spread's coming from. Now, of course, as we looked at earlier, with the populations in those counties, those account for smaller percentages. Middlesex, for example, is only seeing 12 cases per 100,000 people, but there is still just a lot in raw numbers, which, because any one case can launch a super spreader event, which keeps the virus going. All right, and on that cheery note, CLR, let's head into the weekend. But here's one last thought for you. Here is a sculpture in the Netherlands that saved a train from going off the tracks. The sculpture is actually called Saved by the Whale's Tail, and this train was literally saved by the whale's tail. The driver was able to actually walk out of the train himself, and there was no injury as a result of this fortuitous fluke here. So that's just one little positive thing to look at as we go into the weekend. If you want some more positive things, you can find the MassSupport Network on our website or on social media. And remember, wear your mask, wash your hands, and we'll be here if you need us. Stay safe.